Well, thanks everyone for joining us this morning. I'm Jeff Yarbrough, Senator from Nashville, Tennessee. I'm joined by my colleague, Chairwoman Ramesh Akbari, who's joining us from Memphis, and Senator Katrina Robinson, who's actually in Corpus Christi, Texas, where she's helping healthcare providers deal with the spike of COVID cases in that part of the world. As some of you may know, she's actually spent time in New York as well during that earlier peak. But it's one of the reasons that we wanted to have her join in this conversation today. I'm going to start with just a brief overview of why we're having this press conference before turning it over, first to Ramesh, who will lay out a few of the specific steps we believe are essential to move forward. And then we want to bring in Katrina who probably, frankly, more than any policymaker in the state, knows what this is like in the eye of the storm when hospital systems are overwhelmed. And then we'll take your questions. But, the real challenge in Tennessee isn't figuring out what works or what needs to be done to battle COVID. Our problem in Tennessee, just like it is in the country, is whether we're willing to do what we know works, or whether we're going to have to wait and reach an even deeper level of crisis before we respond appropriately. We've been critical of the administration response, somewhat from the outset, and we've spoken out about how the spread of the virus has been going in the wrong direction. But the last 2 weeks should be a wake-up call that Tennessee has a failed response to COVID-19. Tennesseans need Governor Lee to do a complete reboot of his strategy to protect our citizens, and we need him to do that now before it's too late. So yesterday, and I think everybody on the call knows this, but it's worth going back over it, the state confirmed almost 3,400 new cases, which is the highest by far since the pandemic began. Like, that record isn't just because we're doing more testing, it's because the number of people testing positive has gone up to 10%, which is the highest it's been since the beginning of the pandemic and more than double what it used to be. The number of confirmed active cases has doubled in 16 days. We have tens of thousands of active cases, and if that pace continues to accelerate, it will overwhelm our healthcare system. Period. Full stop. Hospitalizations are up, and they're up everywhere across the state. And even though we know that deaths are a lagging indicator and are likely to continue rising, the fatality numbers are already higher than they've been since the start of the pandemic. Basically, every metric we track is going in the wrong direction, and you have to be ignoring reality to think otherwise. And I think it's time that we abandon the wishful thinking that this is just going to go away. And it's also time to acknowledge that the response of the Tennessee state government isn't working. There are some amazing people across the state and across state government who've been working on this nonstop. We're not questioning their efforts, but they've been executing a flawed strategy. And this isn't about Democrats, Republicans, it's about right and wrong. And at this point, it just couldn't be clearer that states like Florida, Georgia, Arizona, and Tennessee adopted the wrong strategy. The governor accepted excessive risks, and he took insufficient precautions, and that's now backfiring on all of us. We shut down too slowly, we reopened too quickly, and we did both of those things too haphazard. And at this point, we've lost almost 800 of our fellow Tennesseans in just 4 months. At that rate, COVID-19 is already on pace to be one of the leading causes of death in Tennessee this year, with more deaths than the flu, more than pneumonia, more than suicide, car wrecks, fire alarms, overdoses, more than diabetes, kidney disease. And frankly, we refuse to believe that the plan of this administration back in April was to be here at this moment in time, just a couple of weeks from when schools are starting back and facing this rate and spread of cases the surge of hospitalizations and this loss of life. And it's foolish to suggest that this was necessary for our economy. If anything, it's been counterproductive. By rushing to get too much of the economy open too fast, we've put the overall economic recovery at far greater risk. Now, all that may sound harsh, but it also happens to be true. And we're not here today just to engage in a blame game for past failures. The past is in the past. And frankly, we're fortunate that we've at least not faced the kind of recklessness we've seen in some states. But the reality of our current situation demands that Governor Lee take the initiative and change the course of action. We believe the governor can do better. We want him to succeed. And all of us in Tennessee need him to succeed. But I don't think anybody should kid themselves that it's going to happen without a pretty significant change. Like, this state needs a complete reset of its response. And I think that at this point, enough with the non-binding pledges and mixed messages on masks. Like, we've had enough of the patchwork, inconsistent, conflicting local decisions. Like, we need the governor to make the tough calls. We've had enough of him looking the other way, while politicians that he's supporting are ignoring common sense and commonly accepted science. I mean, this is just a time that leadership demands that those in power rise to the moment and above party politics. And, like I said, there's no great mystery in what works at this point. We're seeing things that are happening. They're working across the country and across the globe. The question is whether we can escape from the dumb politics that are stopping us and holding us back. I just don't think Tennessee parents are going to be willing to send their kids back to school on the say-so of Donald Trump and Betsy DeVos. We have to do what's right to protect the people who live here. And people in Tennessee have sacrificed a lot already. We all need things to get better for them. They should be able to get back to work. They should be able to send their kids to school. They should be able to visit grandparents at nursing homes. Like, their lives need to get back to normal. But all of that normal that people want requires us to get the virus under control first. And right now, it is just indisputable that we have uncontrolled community spread from one end of the state to the other. We're basically starting, where we were months ago with the most basic goal of containment. And, surely to God, we have the tools to do that, that allow us to get this back under control without going back to lockdown. But it's also going to take a really significant change in strategy and a robust plan that takes advantage of all the tools that we have. And at this point, I want to turn it over to Ramesh to sort of walk us through some of the things that we need to do. But before I get there, the governor is the only person in the state that can get all of our counties working together in the same direction. He's the only one that can get the entire state government to work towards one common goal. Anybody can issue a suggestion to the state or urge the state to wear a mask or make recommendations about how businesses should open and ask that people do the Tennessee Pledge. The governor is the only person in the state who has the authority to issue any type of policy that might be enforceable and actionable and consistently applied across the state. And we can't afford a hands-off policy anymore, whether it's hands-off on county mayors who are ignoring what the science is on masks, or hands-off approach to the Secretary of State, who's been fighting against basic protections for keeping voters safe in the upcoming elections since the outset. But at the end of the day, you can't lead people if you're not willing to level with them. And all of us in Tennessee need Bill Lee to level with us and acknowledge that the status quo is not working. We need a statewide plan, and we need it now. Ramesh?
Yes, certainly. To that point, we do need statewide action in order for us to have a consistent approach, one that really does aggressively tackle this virus that seems to have overtaken our state. Um, we're not able to continue with this kind of patchwork policy or suggestions. And there are experts who have really made it very clear the very simple things that we can do that will make a huge difference in those who are getting the virus and how it overwhelms our hospital systems and eventually looking even at our death rate. One, listen to the experts. It's been made very clear from the CDC, Dr. Fauci, from the World Health Organization, any expert that you can think of has suggested that wide-scale rapid testing and contact tracing is the best way to try and contain things. If you look at countries like Germany or Singapore, these are things that they put in place, and now they're able to open back up again. There's an expression that says go slow so you can go fast. I think that we did not follow that, and now we're having to regress. If you look at some of our larger cities that have had to put in kind of moving back on their phases of reopening, and even looking at our smaller cities and counties that are now struggling with cases when they didn't really have a lot. We're seeing significant delays in our testing, and I know this is part of a nationwide trend, but we have to focus specifically on Tennessee. Our contact tracing has really not been robust. Georgetown has recommended that we need at least 7,000 contact tracers to really be effective. I know at one point there was even a suggestion that people volunteer for this very serious type of work. But with so many people being out of work in Tennessee, this is a perfect way to help get some folks from being unemployed to being employed. And we have funding from our CARES Act funding to be able to pay for that. Looking at masks, I've been wearing a mask since March. It is something very simple that we can do that protects ourselves and protects others, those around us. So I know that the governor signed an executive order giving county mayors discretion where they could put a mask ordinance in place or not. It's time for a statewide mask requirement. I know that it's become very political, but if you even look, our president wore a mask the other day. The vice president has talked about the importance of wearing masks. So surely our folks across the aisle can kind of get behind this. If Texas can do it, then certainly Tennessee can do it. I live in Memphis, and so we are very close to Mississippi, and their numbers are spiking in a way that's out of control as well. And they've put mask regulations in place for specific counties. But you need something that's not piecemeal. It needs to be statewide so everyone's very clear. 95%, if 95% of folks wore masks, our infection rates and our death rate would plummet. And that's from the University of Washington. It's not things that we're making up. These are the experts who have been studying this disease since it kind of came into our orbit, and they're working aggressively to try and defeat it. And I think lastly, something that's really big, and Leader Yarbrough alluded to it, is that the Tennessee Pledge, it's a comprehensive, kit of suggestions for businesses. I think that this stuff needs to be requirements now. And some of our cities have done it, like Memphis requires that you have a mask. I think Nashville's done the same thing if you're out in public or you're in a business. But it's time for uh, a statewide enforcement of the Tennessee Pledge, where it says these are the practices that we think are best. This is what's going to help us reopen safely, and you have to abide by it. It's not a suggestion. You don't say I'm taking the pledge. No, you have to kind of deal with these types of requirements in order to open up safely. The last thing, and we've seen different places in the country, I think New York did this and other more populous areas, is provide assistance for families who are not able to isolate at home safely. We've seen cases spread to an entire household simply because folks are in smaller quarters. They don't have the benefits of having multiple rooms and bedrooms where one person can go and isolate. So providing assistance for folks if they live in these types of circumstances. We do have CARES dollars again where we could use them for this type of assistance, because it's a really big deal. It can stop it from spreading through entire households, and it can also, those who are healthy can continue to work, can continue to function, and not have to, worry about themselves getting ill. So, I mean, these are some really simple things that can be done by our administration, by our governor, that can make a big difference in the health and well-being of those in our state. Because ultimately, at the end of the day, Tennesseans deserve to have regulations put in place that will keep them safe. Just like we regulate speed on the highway, we regulate what books children read in schools, we regulate how people are able to sue or not sue. The government can be helpful, and this is one of those instances where we do need, it's time out for the concept of limited government. We need our government to provide a statewide and standard type of enforcement and metrics so that people can stay safe, period. I mean, it's just, let's get the politics out of it. Let's focus on the policy, and let's help make our state healthier and get us off this list of trends where we're having cases that are just unable to be contained, and hospitals are being overwhelmed, businesses are being forced to close again. So I want to kick it over to Senator Robinson, who is in Texas right now doing the hero's work of trying to help in a health system that they have been overwhelmed. So Senator Robinson, I'm going to kick it over to you now.
Thank you, Ramesh. I think that you and Senator Yarborough have done a good job of outlining what Tennessee is doing wrong and what direction we need to go in. But I want to focus more on the impact of what happens if we don't do what we're supposed to do. And when we look at states like New Jersey, like Missouri, they've been more strict statewide about how they enforce regulation. So New Jersey had one of the strictest, longest stay-at-home orders. There was a rollback plan that was outlined as to how businesses would reopen. And the reason why they did that was to make sure that there was enough lag time, because that's one of the things that we don't talk about is the lag time between the numbers for hospitalizations and deaths as it relates to COVID positive patients. We track the number of positive cases, but we have to focus more on hospitalizations and deaths to see the impact on our economy and on our citizens. And so in New Jersey, the rollback plan, they gave them 14 days where they monitored the hospitalizations, the deaths, and the positive cases, and they did not reopen another phase until they saw 14 consecutive days. So even if they got to the 13th day and it was not on trend, they did not reopen. And the reason why we do that is because the disease does have an incubation period. So that's where the testing comes into play. If I go get tested on Monday and I don't have my results till Friday or Saturday, meanwhile, I've been to session and infected other lawmakers. I've been to dinner, and the disease just continues to spread. And so that's why it's important for us to implement those stay-at-home orders, making sure that our citizens are where they're safe, away from those who are infected. That's the first step to containing the disease. But also, when we look at our healthcare system, yes, we have capacity. We have about 20% capacity left for our ICU beds and our hospital beds. But what happens is it's exponential. So in Texas, they saw, say, 1,000 deaths over the first 53 days. Then 24 days later, they were at 2,000. Then 13 days later, they were at 3,000. So it just starts to snowball into a bigger effect. And that's what puts the strain on the healthcare systems. So not only do you have to manage the beds that are in the system, you have to manage the workers, the medical staff, and the facilities. And I don't think that we're prepared statewide for that, especially in our rural counties that don't have hospitals to get to. And so we would have to absorb some of that stuff as well. But the only way that we would make any advances in containing the virus spread and to prepare our healthcare facilities for what we have at hand right now is to make sure that we do contain the disease and we make mask mandates statewide. One of the reasons why we don't have widespread compliance is because people are confused. I do one thing in Nashville, I do one thing in Memphis, I do one thing in Weakley County. If we have different mayors giving different directions, we're really confusing the process for our citizens, and that's why we end up with the numbers that we have. And I think we can do a better job by making it consistent, the mandate across the state. Memphis, I know we're doing a good job. Nashville is as well, but it has to be enforced, and our businesses have to be monitored too. One of the things that happens is, our businesses aren't getting clear communication as to what the expectation is as far as social distancing, protecting employees and their customers. And so they're open. All they know is they can open at 25 or 50% capacity, but what regulations do they have to meet, and are we enforcing those regulations? And so if we don't want to burden the healthcare system, those are the components that have to be put into place in order to make sure that we're not caught with our pants down, to say the least. So I'm going to give it back to you, Jeff, to wrap up. You're on mute.
Sorry. Thanks, Katrina. And I think Katrina being, is working in the current situation that we're trying to avoid. And, I'm sure that there are people already who just think this is just a bunch of Democrats attacking a Republican. And at this point, I don't really care. At this point, we have to do what's right. And there are lots of Republican governors who are doing good things in this, right? I mean, you can look at Tate Reeves pushing back last night on some of the more knuckleheaded, herd immunity theories that are going around his state. You can look at Greg Abbott, who's, did effectively a statewide mask mandate in Texas. And frankly, I think there's lots of things that we appreciate about Governor Lee. I mean, I think that there's no question that Tennessee came to the testing situation before a lot of our peers, and that should have put us in a better place to prevent where we are. And this is not because we don't think he is capable of doing good things, not because we don't think he has done some good things. It is just a recognition of the reality that if we don't change course, we're in a bad situation in the state, and we are not going to be able to reverse it. So with that, I'll turn it over to y'all for any questions. And just unmute people if you want, Brandon. You're muted.
If you have a question, unmute yourself or raise your hand, and I will and go ahead and ask.
Can you hear me?
Gotcha, Sam.
Yeah, my question is, are you all willing to take responsibility for another economic shutdown? And I know the numbers that came in yesterday were pretty bad as far as revenues returning. If we go backwards, take another step back in phases, will we see another economic shutdown? Are you all okay with that?
At this point, we should have the tools in the toolbox and the knowledge to contain this virus without that shutdown tool. But if we can't, then I think we've got to do what we have to do to shut this virus down from spreading. I think the problem that we've had all along is that there are too many people who see the responding to the health situation and getting the economy going as if they are in competition. And that could not be further from the truth. And we're about to learn this in, all its ugliness in the next few weeks. If you do not contain this virus and people do not feel safe enough to send their kids to school, do not feel safe enough to go to work, then I don't care if you what you're technically reopening, you're not going to be able to grow the economy in the way that we need it to. That can't be the choice that we think about. I don't think that's necessary, but that can't be the choice.
One more thing. Do you all feel like this is just a situation where a lot of people still aren't taking this seriously? You know, you've got the situation where you have these COVID parties where the guy, I believe, Texas maybe, where the guy died at age 30 after going to one of those parties. And just in kind of going around places in Tennessee, I get the feeling that some people still don't think this is something real. And where is that coming from?
Well, I think that is a real problem, Sam. And, you know, I went to New York, you know, and came back to the legislature, and one of the lawmakers asked me, so this is not a hoax? And I was just taken aback that, you know, out of all the data that's there, everything that we see, we don't want to believe that it's real. It's real. And I think that does have a lot to do with the numbers that we're seeing. You know, people don't really believe that it's real until it affects them or someone close to them. We just have to do a better job of putting it in front of them.
Hey guys, not sure. Can you guys hear me?
Yep.
Oh, okay, sorry. So one of the things that, somewhat to Sam's point, is we're talking about the mask mandates, and obviously a lot of this is based on the behavior of business owners and citizens alike. What tools does the legislature or Governor Lee have in his toolbox to enforce, let's say, mandatory mask wearing? You know, or is there any recourse, other fines, from fines to whatever, that can actually make this a reality to where, regardless of where you stand, you know, this is something people will have to abide by?
Well, I mean, I think through the whole process surrounding the Tennessee Pledge, we've actually had a lot of people do the research about what the best health practices are. But it's clear that this is non-binding guidance that's being urged upon people, but not required. And I think it's also self-evident at this point that it's being interpreted and applied in wildly inconsistent ways across the state. And that sort of lack of seriousness of purpose, I think, can't help but translate into the lack of, you know, the community taking it seriously. And I think that you can see that in businesses where, you know, I mean, you go at everything from businesses that are actually not allowing people to wear a mask to people that are, you know, not requiring it and that are cheating the rules to the disadvantage of everyone else. And that's the thing, is like, whether it's young people on a, you know, party bus in Nashville, or if it's old people at a Lowe's in rural Tennessee, people that are cheating the rules are cheating everybody from getting out of this. And we could do that through the legislature. We haven't. Unless we're going to have a special session to actually do that, then the only option is for the governor to actually give his executive order some teeth, and to actually try to make these things, you know, real standards in Tennessee, as opposed to something from the suggestion box.
Okay, thank you.
I've got a question. Y'all hear me okay?
Yep.
Schools across Middle Tennessee are going to be opening soon. Several counties reopening. I guess I should say all of Tennessee. We posed some questions to the governor about what is going to happen if teachers or students are diagnosed with COVID-19 in the classrooms. Haven't heard back yet, but wanted to know what you guys think about what the state should be doing to be guiding school districts as they're trying to reopen during this pandemic.
You know, it's hard for me not to respond to this as somebody who's got a kid that's supposed to start school in 2 weeks. And, you know, there is nothing that parents want more than for their kids to go back to school. And there's nothing that we as policymakers want more than for kids to be at schools for in-person learning. Like, everybody gets that. But as much as I'm dying for kids to go back to school, nobody's willing for people to actually die for our kids to go back to school. And if we're going to be putting our, our kids' grandparents at risk, or putting their teachers at risk, or, even if it's a small chance, putting, our children at risk is not something that we're really designed to do. And, if somebody thinks that parents in Tennessee are going to send their kids back to school just because Betsy DeVos said so, like, they are going to have another thing coming. So, I mean, I think we got to clear away that, sort of context that, like, this is a mandate, or we're going to take away your money from the federal government. And this has to lead with how we are keeping students, teachers, and families safe. And if we can't do that, we're going to have to figure out how to do distant learning, because I don't think there's a different path. And if we really wanted, it would have been the right thing to focus all of our efforts on being able to go into this moment ready for in-person schools. But, like, we haven't done the right steps at this point.
Have you spoken with any teachers about reopening schools?
Hey, I can jump in on that one. Can y'all hear me?
Yes.
Yeah, I spoke with some teachers. As a matter of fact, I actually have family members who are teachers, and they are concerned because not only are they themselves potentially health risk or health risk averse, or not averse, but are more inclined to have potentially a more severe version of COVID, but they themselves are concerned about spreading it to others and what that impact will be. So I've talked to some teachers in the community as well, and I know they're concerned. Shelby County is doing some sort of hybrid model, but regardless, teachers will be required to come to the classrooms and do the training from there. So I think there is some concern, but fortunately, at least in my end of the state, our superintendent has made it very clear that he's going to do what's best for the children, regardless of what bullying tactics are being suggested on a federal level.
That's all I got. Thank you, guys.
Thanks, Kyle.
We have
back to, oh, sorry.
I was just saying we have a few other reporters who are unmuted. Please feel free to go ahead.
Thank you. I have a question about enforcement of mask mandates. I've spoken to a couple of sheriffs whose counties have mask mandates, but they've chosen not to actively issue citations for violations. If there was a statewide mask mandate, how would enforcement be handled?
Well, I think, go ahead. I'm sorry.
No, go ahead, Ramesh.
I was just going to say, I think that, again, that is something that if it is a statewide mandate, our law enforcement officials would need to enforce it. And I'm not talking about arresting people or anything aggressive like that, but certainly issuing reminders. And I think other states have actually have financial consequences if people don't wear a mask. But I think it's an opportunity for law enforcement to issue warnings and also even give out masks. I mean, there are some people who don't have them, which is why myself and Karen Camper put together a Mask Up Memphis initiative that has been giving out masks. But I think also there are others who are just willfully not wanting to wear a mask because they just don't want to do it, or they think it's political, or they believe this unfortunate nonsense that your oxygen saturation rates go down or things like that. So I think the law enforcement has an opportunity. I mean, if they see it and they're saying they're not issuing citations, I think just like other laws or ordinances or executive orders that are passed, they would have to enforce it.
You know, I mean, one thing that I think gets lost in some of this mask conversation, you know, I mean, yes, I think there needs to be a pathway for enforcement, especially of egregious violations. But the status quo is, if there's not a mask mandate, you're basically pushing the decision making and enforcement down to the level of businesses who are desperate for business right now, trying to keep things safe, and people are coming in without wearing masks, and we're asking them on their own initiative to like push a policy that we as a state aren't willing to stand behind. And that's what's pathetic about it.
Thank you. And then another question on a different topic. In light of the 3 positive cases recently reported in the legislative community, would you all suggest further precautions be taken in preparation for the anticipated special session?
I would absolutely suggest that. I think we should be mandating that we wear masks on the floor and in committee. I think we can do a better job of distancing ourselves. And as far as even managing our own offices in the legislative class, we have to have some kind of leeway as to how we can still conduct business, but be safe and respectful of other people. We can't politicize people's health just because we think that it's hoax. And that's why we're in the situation that we're in. So maybe that will spark the conversation that says, hey, this is not a game. We need to be wearing masks while we're in session. So I'm hoping that's what we see when we go back.
And to Katrina's point, our staff members and visitors are required to wear a mask in common areas, and they are temperature checked. So I think that it would be hypocritical and counterproductive for members not to have to wear a mask as well. It's really the people in Tennessee elect us and send us there to do our job. And it's really unfortunate that politics makes it potentially unsafe because we're all wearing masks and we're protecting those around us. But those around us are not wearing masks to protect us. And I think it's been confirmed multiple ways. This is not a political thing. It is the best policy to keep people safe. And you see what happened in Mississippi with 26 legislators now, including the lieutenant governor and the speaker of the House, now positive with COVID-19. I mean, we don't want our special session to be a super spreader event. And it's something so small that we could do that would make a tremendous difference.
Thank you.